I'm Dr. Sarah Olivo.
And I'm Dr. Liz Seidler, and you're listening to College is Fine, Everything's Fine. In this week's episode, we were lucky to have a college student agree to sit down in Sarah's office and do an analog or pretend therapy session so that our listeners could have an idea of what it would look like for the first time to have an intake session with a therapist.
I know. We had such a brave student and ambassador who agreed to do this for us today. She was so open and willing to share some of her thoughts. So she's a rock star. We couldn't have done this without her. And I always felt like it's so interesting. And everyone I talk to, I don't know about you, Liz, wants to be a fly on the wall of a therapy session.
Oh, yeah.
You know, do you ever get that?
Oh, definitely. A friend stopped by to give me coffee yesterday, and she knew I was going to have like a virtual appointment. She's like, I just like sit in the corner. And I was like, absolutely not. So lucky, like we said, this student, Anushka, she's agreed to share her name, was willing to sit down with Sarah and have an initial CBT intake appointment.
Right. So a couple of things to note. One is that I would say the reason I think people are really intrigued also is related to why we wanted to do this, which is that a lot of people feel intimidated to even make that call. They don't know where to start. And I think not knowing what it's like, sometimes it's not just curiosity, it's anxiety. And that is what keeps people from making that call. So the reason we felt like this could be hopefully cool and interesting to hear, but also that it could give you a window into what it might be like so that if you hear it and it feels like, oh, that's not so bad, maybe you could make that call. I also want to say that I actually have a lot of anxiety going into this. I'm just noticing my anxious thoughts because people can listen to this and hear me as a therapist and wonder like, oh, what's she getting paid for? There's nervousness around kind of, I feel vulnerable too, but that's why I'm so happy, Liz, that you got to listen to this and give your thoughts. And we want to make sure the audience knows this is a general idea of a session. At the same time, sessions, they can vary widely, certainly therapists vary widely. So we wanted you to get a general sense of this, but obviously there's a wide range and I might not be your style. Liz might not be your style, but there is a therapist out there for you. Sometimes it takes a little work to find the right fit, and personality fit don't you think that's so important?
Oh, I say to people all the time that I, even as a therapist, probably know after the first session if a patient's a good fit for me or not. And I'm very transparent about that. Not just the problems that they're struggling with in terms of me having expertise, which, just a side tangent, usually you will have a screener call that you'll have with a clinician if they have availability to see you, where you kind of just talk for 5 or 10 minutes. And you're just sharing some of brief details about what's going on and your reason for seeking help. And if a therapist decides, you know what, like you're facing some issues that I feel like I have expertise in, I have availability, and you come in, really what you're trying to assess in that first meeting is fit. Particularly like if you compared Sarah and I, we have really similar backgrounds. We might have some strengths in certain areas, but for certain problems, we're pretty similar in terms of our training and expertise. That really it comes down to, do I like this person? What's their sense of humor, their style? How do I feel in the room? Kind of what we would call, again, like our wise mind or our gut afterwards, might indicate like, okay, I want to move forward with this person, or sometimes not. And I think that's something that maybe to even highlight, some people feel compelled to stay with a therapist, even if they feel like it's not a good fit. I know it's hard to find therapists right now, but really shop around, ask questions, really think about, is this the right person that I want to work with?
Yeah, it's totally okay to shop around. Make some calls, look at websites, do some due diligence to see, is this the right person? Yes, in terms of that kind of therapy you want in their training, but also, are they a right fit for me? Sometimes people want a little tough love. Some people want something warm and fuzzy, sometimes a mixture of both. So again, there's a therapist out there for you. So, all right. So you finally found your therapist. Liz, what are you looking for? You already mentioned a little bit. So you said in that first call, you're really looking for, some basics. Does my schedule fit? And do I have the skill set that you need? Am I the right person?
Yeah, I'm essentially looking for if you know what your problem is, can you label it? And is it something that I feel comfortable treating? So for example, I'm not an eating disorders expert. So if you're really struggling with eating, I want to refer you to somebody that's an expert in that area.
Right.
if you call me and say that you're anxious and depressed, that's something that I, deal with daily. So
Right.
I really feel comfortable kind of treating those problem areas. And sometimes people don't really know. They might kind
Yeah.
of say like, I'm having a hard transition or I'm just struggling. And in those cases, then I'm like, you know what, you need to maybe come in and I'll ask you some more questions in person to kind of get a bigger assessment of what's going on. And if I determine that I'm not a good fit in that intake appointment, then I'm going to help you hopefully find somebody that has expertise in the area that you're struggling with.
Right. We also want to really make sure that you're aware we are two people in private practice who have our own style. And this is probably what we're discussing is probably what the initial part of this feels very similar to other people in private practice. But let's be real. There's a lot of different ways to find a therapist. Sometimes it's through your pediatrician, a wider group practice, a medical practice, through an academic center. And if we're talking to college students, a lot of times it's the college counseling center. So some of these initial pieces might not feel familiar. I do think that once we get into that first session, there's some generalities that you can assume are going to take place. Once you're in the session, we wanted to share with you guys a little bit of what we might be thinking. What are we looking for in that first session? So I think in general, it's fair to say that the person is going to be taking sort of their background and their training. Am I a CBT therapist? Okay, I'm going to be kind of paying attention to this from a CBT perspective. Am I a psychodynamic perspective? Am I doing this from a DBT perspective? There's all sorts of letters and so on and so forth, right? But in short, the therapist will be thinking about, okay, what is my general approach? And that's what you should know too as a student, that therapists have sometimes a very specific approach. They only practice cognitive behavioral therapy, or it's brothers and sisters. Sometimes therapists have what they call an eclectic approach. They have a wide range of various training, but they have a more sort of general or eclectic approach to things. So that's something for you to know ahead of time. Are you okay with their approach? But once you're in there, the therapist is going to be starting to ask questions to think about how, based on the way I see the issue, am I going to get to know this client enough so that I can figure out a treatment plan and help them feel better, help their symptoms become less intense or less frequent. Is that fair to say?
Yeah, definitely fair to say. I think, people see therapists taking notes and they're like, what are they writing over there? Right. But essentially, in that initial appointment, we're trying to take a history of your life, essentially, and then a current assessment of what's going on that's kind of getting in the way of your functioning. And then viewing it through these different filters or lenses based upon what type of therapy that you're seeking. But you're going to hear a lot in this episode around cognitive behavioral therapy and CBT, because that is the therapeutic practice that Sarah and I both have adopted. I was thinking, Sarah, like where to start, that I think the initial question I often ask people can be really overwhelming now that I think about it. And when I was listening to your episode with Anushka, is like, why are you seeking treatment? Right. And there could be a million reasons for that. But if you're going to see a CBT therapist, the things I'm looking for when I ask that question is, are there behaviors or emotions that are a problem for you? Are they impacting the quality of your life? Are you feeling too little of certain emotions, too much of others? Are there behaviors you're trying to do but can't? Are there too many behaviors that you're engaging in that you realize aren't really great for you? So we're looking for what symptoms are you experiencing? And that usually is in the feeling or behavioral kind of area. And what kind of impact is that having on your life? And when I think about impact, I'm thinking about, is it influencing your relationships? Is it influencing your activities of daily living, like the ability to shower, go to bed, eat? And then is it impacting your occupation, being a student, your academics, your job? Where do you see that it's, having a negative impact on your life?
I'm always writing things down too. And I try to show people, I'm like, first of all, I'm making sure I'm getting the names right, of like your sisters and your brothers and so on and so forth. And also, sometimes people will say to me, oh my gosh, am I even making sense? And I say, your job is just to talk. And I'm going to be organizing it. As I'm writing, I'm taking what you're saying and I'm just trying to put it into a place for later. And I'm going to share all that with you. So they're not writing down deep, dark secrets. Most likely they're just trying to make what you're able to say, so you can just talk free flow style, fit into where they can help you the most. So that they're kind of actively listening and writing for that reason. All right. So we've talked about the call, you're going into session. Let's hear a little bit about what that first part of a session can sound like. So I know we talked a little bit on the phone about some of the things that have been on your mind, kind of enough to know that this felt like the right fit in terms of what you needed to get out of it and what I could offer you. I want to try to ask a few questions and then see if we can make sure that some of the things that you're talking to me about, we make a plan and I can give you some strategies or give you at least a roadmap for how I can work with you in those ways. Let's go into it in a little bit more detail. Do you just have a quick spiel on what brought you in today?
Yeah, of course. So I think this past semester, a lot of what I've been struggling with is this feeling of imposter syndrome. And like one of the classes that I was taking last semester was organic chemistry, and like being a pre-med student, like organic chemistry is kind of known as like one of the weed out classes and like the most difficult classes. And throughout like the semester, I just like felt more, I guess like, I don't like using this word, but I guess like dumber or like not as smart.
So you're suddenly in this room of people who typically you'd feel pretty comfortable. You're in a class, you've taken certain things before, you have a good reason for doing it. And suddenly out of nowhere, you're struck with this idea that it sounds like you don't experience a lot, which is the dumb word, the D word. And then when you feel that, even though you said, no, I technically know that that's not a word that we're supposed to say to ourselves. And so even though logically you know, oh, I know I'm not quote unquote dumb, I feel this in the moment. What are some things that bring that up for you? What are some of the triggers?
Yeah, I mean, I guess like just low test grades, and that was like a big theme for me in this class. We only had 2 exams and like 1 final. And like on both exams, like I scored pretty much like below average. And that's not something that I was ever used to. In most classes, like I was the type of like overachiever to be on like the high end. So just like kind of like having those roles reversed.
The other thing we should mention is that Liz and I are cognitive behavioral therapists. So you hear us say CBT a lot. It's short for cognitive behavioral therapy. That can actually mean a wide range of therapies. But the main thing that they have in common is they're looking at the interaction between how you think, where that helps you, where that hurts you, where that gets in the way, what actions you're engaging in that are making your symptoms flare up or keeping them around longer than they need to, and also paying attention to your body. Like, what are some of the red flags that your body is sending to you to say you're stressed, you're anxious? And then sometimes, are those body signals accurate or are they false alarms? So that's the very general thing that we're trying to look at. Various thought patterns, self-talk, certain avoidance behaviors or withdrawal behaviors are oftentimes something we see in anxiety and depression, where we're just trying to kind of pay attention to those things. So in CBT, Liz and I are probably commonly trying to look for certain words that come up. We're going to be starting to look at ways that people are thinking that fall into some pretty understandable or common categories for anxiety or depression. And our ears are sort of perked for that.
Just like taking a small thing and making it kind of like this volcano in my mind. There's like kind of like the angel and the devil.
You know, certain phrases like imposter syndrome comes up today. I hear that all the time. Or certain words like always or never or must. My ear starts to pay attention. Okay, what comes after those words, right? So you're just trying to kind of pay attention. You're hearing the story, but you're paying attention to certain themes or words you know might indicate a thing to work on.
Let's hear a little bit more from their session.
I think I've taken a lot of time in like trying to understand myself and develop that like level of self-awareness where like I know I'm the type of person to not care what my friends think or what like other people think, but I care a lot about what my parents think. More of like people who are older than me and people I look up to, I really like kind of crave that like acceptance. So I think like other people's, in my head, like my perception of other people's expectations of me kind of prevents me sometimes from doing what I want or feeling the way that I want. I have like an older sister who's also pre-med, and she's 1 year older. It is difficult being the younger sister, and just like she's very like able to like multitask a lot of different things and do well. And I felt like she had taken the course that I was taking, and she ended up doing really well. And at that point where I was withdrawing, I kept comparing myself to her and being like, she was able to do this and she did it well. Why am I not able to do that as well? And then like it was kind of like this battle in my mind where I'm like, yes, but you're not her, you're your own person, so you cannot have that expectation of yourself. So it was like kind of like the angel and the devil, and like both sides like talking to me.
You mentioned imposter syndrome, okay, and then you mentioned comparisons to an older sister, right, to just have that nice easy comparison there. And you mentioned the need to seek approval or gain the approval in general, right? Imposter syndrome might encompass some of the comparisons and so on and so forth, but there's a little bit of addition to that term. It means I shouldn't be here. That somehow I got here and I'm a fake and I'm going to be discovered as a fake. Is that what you mean when you say imposter syndrome?
Whenever I'm in a room with like other pre-med students, I'm always like, they're smarter than me.
So can I ask a little bit about when you're with your sister and you're saying, my sister could take this class and my sister can do X, Y, and Z and she can do this. And when I'm in class with medical students, they are able to do X, Y, and Z. They can multitask. And then you share, I have anxiety and I have ADD. Those things both take a lot of energy and can be, at the end of the day, draining, right? Because your mind is having to work to battle some of the anxiety, and your mind is having to work to, chug and get the engine revving a bit more in terms of organizing your mind and ADHD, etc. What kind of emotions and thoughts come up when you see people who, in your eyes, have it more easily than you?
Yeah. I will answer that. I just want to go back just a little bit.
Please do, and always correct me if I've said something that's off.
No. Not correcting you. Just like kind of like explaining something a little bit more, because I feel like, at least like my relationship with my sister, I think it's honestly like really good.
Well, let me start by saying I'm really glad you clarified, and this is something that happens a lot when people come in. They describe something that's difficult for them for whatever reason. There's a person in their life who might be a cue or a trigger for some of those things, and then they feel, maybe a little guilt. They really want to clarify to me, by the way, I love my mom, dad, sister, brother. Yeah. It's just that insert, I just want to be really straightforward and clear. Whenever someone comes in and they start to describe some of these things, I'm also in my head holding a dialectic that I know might be coming, which is to say, and you said it yourself, two things are true at the exact same time. Yeah. I love my sister. I'm proud of her. She's proud of me. We support each other. And I only have excitement for her that she's doing well. I can hold all of that inside me, and at the same time, some of the ways in which she does well just so happen to be real areas of sensitivity for me. Right. And that's hard. And when I see it, along with proudness for her, A+, 98, whatever, comes sadness for me. And that those two things can be hard to hold at the same time, and they can be true at the same time. So for you to know, and also to just give you some comfort when you're describing anything with me, whether it's about your parents, a friend, I'm never going to assume that that's the only part of the story is the hard part. Yeah. Unless you tell me and we talk about it a bit more and we realize, no, maybe this is a bit more of a difficult friendship. But I'm always going to guess and assume first that there is that, what we think of as a dialectic. Yeah. That you love your sister, you support her, she loves you. And some of the ways that she thrives happen to be some of the ways that you're struggling. Yeah. Who wouldn't have a hard time? Yeah. And so the reason I say that is because we don't want to throw away and just kind of push to the side your version of what you go through so quickly, right? Because if you're saying, like, I looked at that 98 and it made me feel like I got punched in the stomach, if we go too quickly, but I love my sister and she's okay, then I'm worried that we're not going to take enough care of the part of you that got punched in the stomach.
You just heard Sarah talk with the student about their relationship history, who are some of the key players in their life. And the rationale for doing that is to understand, are the dynamics in these relationships helping the student? Is there something that maybe they need to work on? Are they getting their needs met? Are they able to say no? And this could be with family, friends, professors. So a really important part in the first assessment is to understand, what does the social support system look like? And because we're human beings, what's going on in our relationships really impacts our psychological functioning. So that's why Sarah really took her time to really understand the landscape of Anushka's social life.
Right. I think a big myth about CBT is that we don't care about the past.
Oh, yeah.
I'm like, no, of course, that's where so many of these patterns begin. And it's such an easy way to validate the story of how someone got to where they are. I talk a lot about the past. I just don't want to stay there too long. We can't recreate the past. We can't relive it. But it's important to know that it's there as sort of something to say, oh yeah, of course that memory comes up for you all the time. And that's why you do X, Y, and Z thing, you know? So I think that that's another piece of it too. It is important to understand not only relationships in that landscape, but your middle school and high school experience in general. Some, you know, some of us, we all have those sort of stories that make us, you know, either smile or feel down or feel shame. And those are sort of stories that pop up all the time for us, and they're almost like habit. And it's important to get to know those because they're probably impacting your current day-to-day functioning. And that's, again, where we're going to try to maybe be a little bit different and focus, is to say, wow, when you have that memory, you really stay home all day, or you sort of withdraw. And so let's take a look at how we can have a different relationship with that memory, right? So we're just trying to sort of pull it into the present and get to be able to manage it in the present. So I was really happy when Anushka started to talk about some relationships she had with her family early on, some difficult medical history she had. We didn't share all of this in there, but that was really important for me to hear kind of why she was at this particular place right now, feeling the way she was feeling.
Yeah. I'm glad you mentioned that. I think the assessment is really that first appointment. You're going to talk a lot probably about your past. And sometimes that can be confusing for people, particularly if they don't want to talk about their past. But I think, Sarah, you're right. You know, sometimes I'm working with someone and knowing that they had like severe separation anxiety when they started kindergarten, or they were an extremely picky eater, does kind of help understand why they might be struggling with something now. Like, what does the trajectory kind of looked like in terms of your temperament, your personality? And then, of course, were there any stressful life events as you've aged into young adulthood that might have been some points in time where your mood has shifted or changed, or you started to develop some of the difficulties that you're currently facing?
And I also get really curious when they've had really wonderful, easygoing times in their life. I'll say, let's pay attention to that. What was going on? You obviously can't have control over everything, but let's sort of see what was happening and what were you doing then that we can try to recreate or get you back to. So you clearly had some strengths going on for you. Those are still there. What are we able to use? That's good information. So again, I always just love to debunk the CBT therapists don't care about the past myth.
Sarah, you know, we were just talking about assessing relationships and how that might impact why somebody's going to treatment. And I noticed with Anushka, she was talking about her family, and you kind of caught her, I think, in some over-explaining or kind of justifying how wonderful like her family
my dad's
is.
Wonderful.
And
my
like,
sister's wonderful.
I know, which they are.
Right.
They sound wonderful.
I know. I'm like,
they sound wonderful.
Too.
I know. And is that something that you tend to see, that people kind of are afraid to present people maybe in a way, or they want to make sure that we get the exact impression of who their loved ones are?
Yeah, I mean, not always. I think it's fine to come in and just like lay it out and have faith that the person isn't going to judge them or judge you, and to be able to kind of hold that objectively. But I do have people who come in a fair bit. Do you? I mean, I think it's definitely something I see enough to be like, oh, I know what's happening here. You don't want me to think badly of your sister. And so that's when I always try to point out that dialectic, like, and that I hold that too. I'm not going to suddenly have a black and white response and decide that, your sister's no good for you.
Right. Yeah. And I think people also think parents get blamed for everything. So if they have a really good relationship with their family, they're like, okay, they're not responsible for what's going on with me, right? I'm not here to point fingers. And if I could point to the exact reason why anyone develops any problem, then I probably wouldn't. Maybe I would be on a
you'd
podcast,
be a psychic or something.
I know, yeah. So it's really more about just understanding what influence does this person have in your life? What role did they have in this experience? And that it's unjustified to feel any guilt if you're sharing the good, the bad, the in-between.
Right. And if you're feeling guilty about talking about someone in a therapy session with me, the chances are you feel guilty sometimes about being mad at them when we all would understand that. So it's something you want to tackle pretty early, I think. So Liz, you're done with your first session or two. What do you want to know by the end? What are the things that you've pulled together in your mind and are ready to share?
So by the end of the first session, I want the client to leave with some kind of treatment plan that I'm proposing. I've kind of gone over the CBT model of emotions. I've outlined some treatment goals. What are some behaviors you want to increase or decrease? What are some symptoms that you want reduced? And that I want some commitment. Does this sound like something that you're interested in? Let's see how Sarah wraps up this first session with Anushka.
What I hear overall, and one of the ways I want to think through how can I help, right, is to say, okay, one is noticing some of these patterns of thinking, catastrophizing, some mind reading that's going on, this sort of imposter syndrome, you shouldn't be, in pre-med, and then also a lot of future predictions. I'm never going to get into medical school and so on and so forth. All of those things are thoughts, right? But then those thoughts influence how you act. So if you're sad, you're more likely to stay in bed. I've definitely had people with imposter syndrome, rethink whether they should even be at the school and transfer, which is a big version of that, or even say, okay, I'm going to minimize or sort of reduce the amount of things, live sort of a smaller life on campus because I want to only do things that make me feel safe. That fear of being outed, keeps me from not engaging in things unless they're really in my comfort zone. So they live sort of a smaller life. What we want to look at is how your thoughts are working, how much you're buying into them when you have them, right? And then are your actions based in those things, keeping those thoughts and kind of having them chug along, or are they aligned with your overall, to your point, kind of zooming out your bigger goals? So if you're somebody who says, I eventually want to be, you said, a psychiatrist, well, what is going to help? Is it going to help if you start to really hook into thoughts like, I'll never make it, this is too hard? Or is it something where you can say, okay, well, I'm having a lot of these thoughts, and my bigger long-term goal is to become a psychiatrist or whatever type of doctor, and this is part of the process, is to sort of manage the hard times because I have a big goal in mind. So we will be looking at some of the ways that your mind has certain thought patterns. We'll be getting to know what kind of actions are you doing that really help you for your goals versus they're really more helpful for your anxiety and depression than they are for your goals, We'll be paying a lot of attention to what feelings do you have, what emotions do you have that you try to avoid too. Some people just, they'll do whatever it takes to avoid anxiety or to avoid sadness, but again, that kind of leads to a smaller life. So we'll be talking with you a lot about the bigger goals you have, both for school as well as in, life with friendships and so on and so forth. What are the values you want driving you? Where do you see yourself wanting to go? What are the sort of bigger words and terms that are important to you? The reasons you might want to be a psychiatrist, helping others, being an advocate. The reasons that I want to see friends even when I'm sad, having that connection with other people. Are those the things driving your behaviors? Or is it sadness, anxiety, some of those emotions? And once we get to know this, then we can start to engage in some experiments a bit. When I'm feeling sad, what happens if while I'm feeling sad, I act as if I'm not, right? I act on the value of community with my friends and that connection. I have that lead my action. What happens to the sadness if you get out of bed, even if you're feeling sad, and you sort of trudge over and you text a friend, hey, let's meet up for coffee, right? What could you imagine would happen to sadness if you acted on a value of friendship instead of the sadness? So you go to coffee, and what?
Well, I think that, like, obviously, like, I don't know if it wouldn't go away, but I'd be redirected towards, like, something else, like the positive emotions of, like, friendship and, like, seeing someone I care about, and spending time with them. And I guess, like, it's kind of like a distraction, which can be good, because then when you go back to your room or whatever it is, you come back with, like, the knowledge that, like, this feeling it's, like, temporary, right? It's not permanent, because, look, you just went for an hour and you had a good conversation, a good time, so, like, it makes it more manageable, I guess, like, when you realize that, like, sadness is just temporary.
Exactly. So that's what our work will be like, right? We're going to be thinking about how you think. I'm going to be paying attention to that, having you track some of that between session 2, because let me tell you, this is a 45-minute session, and I'm going to guess you have a big life outside of these 4 walls. And what we want to try to do is to say, what are you learning about here that we can take and implement and get to know outside of this room? So talking a bit about tracking some of those thoughts, paying attention to which type of patterns pop up. We'll also be talking about how those thoughts lead to actions that keep you stuck. We'll start to get to know those outside of just the ones we talked about today, and think through what are some actions that you can actually do instead to reverse this cycle. And we'll be getting to know, too, which are the emotions that are the hardest for you to tolerate, and when do you need to tolerate them to reach a bigger goal or to act on the value of something like friendship or achievement, as opposed to just in the moment not wanting to feel this feeling. So that is what we'll do, and we'll sometimes even say, hey, let's try an experiment today. What happens if you go and apply for another class that feels like a stretch, right? Because the last thing I'd want you to do is to say, oh, I took a risk in this class and it didn't work out, so that means I should never try and stretch my academic potential again. That decision shouldn't be based on fear. That should be based on your overall bigger goals, right? So that's the kind of thing we'll pay attention to. How can we notice and have some experiments around what actions you do that make you feel better, and also what thoughts that you can challenge a bit and not have them lead your actions. Some of the things we're going to be talking about in here, we're going to want to have implemented and sprinkled into your real life. How does that sound to you? Does it feel okay for us to talk about ways to track your thoughts or look at some of your actions and practice some of these things outside of session?
Yeah, that sounds good.
You heard Sarah in this episode talk a little bit about giving homework or practice, but I'm a pretty good therapist, but 45 minutes once a week is such a small percentage of your time, so that you really, for things to kind of move along in treatment, you got to be able to and willing to work on things outside of my office. So those are the things. I want to be clear that although this is an ongoing process, at this point, we've identified these problem areas. These are my suggestions in terms of some skills or directions of skills that I think we should go into. Are you on board? And are you willing to put in the work?
Yeah, a little bit of buy-in, because I agree. I'm also not so great that I can take 45 minutes and expand it out. So I'm kind of like, how are we going to sprinkle this into your life every day, in some way, shape, or form? So yeah, and it is collaborative. You want to be able to share, by the end of the session, we have something called a case conceptualization. So there's a lot of words for saying, what are the thoughts or the actions or the feelings, the relationships? So what's sort of the roadmap that has created the anxiety or the depression or what have you, the stressor, the stuckness? And what are the ways in which I plan to help you navigate through that and out of that? And so that is what we're essentially sharing, is to say, okay, here's how I think about it. Here's how I want to help you navigate through it and out of it. Or at the very least, sometimes you can't solve every problem, how to sort of stay calm in the storm of life when you need to. And does that sound right to you? So yeah, so buy-in, some commitment. And yeah, to say, like, if the more you work outside of session, the more quickly these ideas are going to be able to really take hold. So that is such an important part of CBT, and something that might feel different than maybe more supportive therapy. We're going to be checking in. I usually want to hear from someone the next session. Okay, what do you remember from last week? And what kind of hit home? What are you still confused about? Where did you practice some of this? Where was it hard? That's going to be sort of the beginning of the following session is some, to pull a thread in between session 1, 2, 3, 4, etc. All right. We've talked a little bit about how you kind of start that call, what it might feel like in the room, what your therapist might be thinking. And I'm curious from our audience, is that what you thought we would be thinking? I would love to hear you guys share. Does this feel okay? Does it still feel scary? We're hoping that this can help anyone who's feeling that sort of hesitancy to make that call or send that email. In terms of our next session, Liz, do you want to share the big, fun, juicy details, what they'll get to hear next week?
So next week's session, we're going to really show you what CBT is. You'll hear Sarah identify thinking mistakes, patterns that people can get into in terms of their thoughts that might lead to some unwanted emotions. Sarah will flesh out a little bit more. I know we talked about it today, what the thought, behavior, emotional model looks like in CBT. And again, identify some behavioral patterns and emotional patterns that exist for this student. And then she'll do what we just talked about. You'll hear her kind of establish a treatment plan, orient to practice, and check in with the student to see okay, are you on board for what I'm selling?
Yep. All right. We'll have to hear what she says. All right. We want to thank Anushka so much for taking the time. Anushka, you're the best. Thank you.
We're not going to expect to see any change overnight to build the base before you can see the results. But I'm very aligned with you getting to that goal so that you don't have to be in therapy anymore. You can go and study or spend time with your sister or go to coffee with that friend. And that's my goal too, to have you learn these things yourself and then be able to be your own therapist and internalize some of this for yourself. Make it unique to you. Sound good?
Yep.
Can't wait to start therapy!
Yay!
Thank you to our guests for sharing their stories and their advice. This podcast is for college students, and we want input by college students, so please reach out by text, email, or voice memo to collegesfinepodcast@gmail.com or 929-500-2231. Tell us your story, give us tips on topics you'd like to hear, or give us feedback about an episode.
Follow us on TikTok and Instagram at College is Fine Podcast for episode announcements and resources. And last but not least, if you enjoyed today's episode, please subscribe to the podcast. Every hit of that plus button helps us keep going.